everybody, my name is Mona. So today I'll be making another journal video. So we'll be talking about transference, counter-transference, prejudice, judgment, and bias. So I would say transference is just transferring the a behavior away from the source of the cause of the behavior. For instance, I had a patient one time. So this patient told me, actually this patient told me that I was just whenever I ask the patient question, the patient is very irritated. Patient is very irritated. He's saying that is how the previous nurse during the previous admission kept on asking him too many questions. That's that I'm behaving like the previous nurse. So he was really very like transferring whatever that happened to me, believing that, like, having that reflection that I am behaving like the previous nurse. That's on the other side. I was like, hey, I am a different person. I'm a different individual. I was only trying to help you. I'm just helping you in the hospital, helping you to feel better. So, transference is just like transferring that behavior away from the source, the original cause of that behavior, which is the previous experience. Then for me, I'm a kind of like defending myself, because it's a kind of like a defensive mechanism. So that would be like a counter transference. Transference originates from the patient, especially during a previous encounter or previous experience, while a counter transference comes from the healthcare personnel that is like rendering the care at the moment the patient is like transferring that behavior away from the source. So talking about judgment, judgment in the practice usually occur when you don't even know when it occurs. Like, you try to judge patient. For instance, I'm gonna say I had a patient with suicidal tendencies. So patient actually was brought because of suicide ideation, but she was like severely depressed. She's been having some mental health problems going on. So patient told me that the family, she's not like it's the member of the family, because it's a kind of like psychotic thing. She was like, this is not my mom, this is not my dad, they are not my siblings, they don't like me, I'm too dirty, they keep saying I'm too dirty, they don't want to associate with me, they are not my parents. So I was a kind of like, no, they are your parents, these are your siblings, you cannot function without them, you need them to function. So that was what she was telling me when I was trying to get some admission questions from her. So along the line, so I was trying to talk to her. Next thing she says, hey, stop judging me. So not like I was trying to judge the patient at the time, right? So sometimes judgment happens, like not like you're judging a patient, but at that moment you're just trying to judge the patient's situation. Okay, I'm gonna give you another example. I had a patient came in with alcohol withdrawal, alcohol dependency. So sometimes patient was confused, psychotic, patient was being treated, patient is refusing medications, patient doesn't understand things, lacks capacity. So I came to administer medications. Hey, I have your medications here with you, please can you take your medication, this is your haloperidol. Patient is like, no, I don't want it, take away your medicine, take away your medicine, take away this, take away that, I'm okay. That kind of a thing. I can go ahead to say, I can majestically work out if patient is refusing. By the way, that is the patient's choice. Is his choice to drink because of his poor life choices, is his choice to do anything. But as a medical health personnel, I kept on persuading, calling family, can you talk to patient, please, patient is not taking medication, letting the doctors know, letting the charge nurses know, putting a lot effort. Sometimes that judgment comes in. Why am I even stressing myself when the patient made a decision to drink, when patient has been like talked about drinking and ways to prevent drinking, patient is still drinking. These are like life choices. these are life choices. And most of the times when somebody is like, is in contact with some other person with negative life choice, there is this judgment that comes within, especially, yeah, he or she is doing that because of their life choices. You're already judging them. So that's what I think judgment is all about in this all these situations, transference, prejudice, bias, all judgment, all these things I've seen like in the typical nursing day, typical rotation day. So irrespective of that, care still continues, irrespective of the fact that inside you having this judgment for a patient for poor life choices. You got to do the best for this patient. You got to make this patient feel better. We have to devise a means for them to take their medication, irrespective of their poor life choices, irrespective of their decision from poor life choices. At that point, like a healthcare personnel's judgment doesn't matter. The goal is to make the patient feel better. In as much as sometimes they try to transfer whatever that has happened in previous admissions to to another patient, to a healthcare personnel, irrespective of that, care will still go on. It's just defend yourself, ability to defend yourself, and like typically show them that you are different from whatever they've experienced, whatever they've encountered previously. Like I'm different, I'm just a different person. I don't know what happened, I don't know what transpired, but this patient experience is gonna be different this time around. So to prevent these things from happening, usually what I do, um I try to talk to my preceptors, I try to talk to senior colleagues, how they deal with these situations in the past. Also, I engage in professional development programs, helping me to deal with judgment, which is the most important. Like for me, you don't have to judge people irrespective of anything that happens. So I engage in like professional development programs just to help me overcome that situation in future whenever it arises. Thank you very much.